So today I'm going to demonstrate central venous catheterization, which may be needed in a number of situations. I'll be using the Seldinger technique, of course, while keeping in mind the several complications which may be associated with this procedure. I'll be taking the internal jugular approach on this patient, and in the next diagram you can see the local anatomy. So I'll be using USG, and which has become the standard of care, and you will be expecting a view like this, the guide wire inside the vein and not the artery. I have explained the procedure to the patient, taken his consent, and of course prepped everything. So I'm locating the prick site with the help of USG and giving local anesthesia, 2% lignocaine, in order to make the procedure pain-free for the patient. Now I am about to introduce the introducer needle under USG guidance. I have located the carotid artery and the internal jugular vein on the monitor, and as you can see, the vein is compressible. You can see the needle moving on the screen as I am going inside. Yes, there it is, shining inside the vein, withdrawing blood. Now I am introducing the guide wire. Once again checking that the guide wire is inside the vein. Yes, it's there. Taking the needle out. Now I'll be dilating the tissue with the tissue dilator. Putting in the central line itself. The line is going smoothly without any obstacle. Now that the line is in, it's time to take the guide wire out. With all that done, now I'll be flushing each port with normal saline. Now I'll be securing the line in its place by putting in 2 sutures. It's time to stitch up. I'm trying to be very careful because I do not want to prick the line itself and spoil all my effort.
ये 93 आया तो मैं शुगर ट्रीटमेंट का तो मैं ये
कितना में चल रहा है इंसुलिन इंफ्यूशन?
इंसुलिन तो सर स्टॉप हो गया 132 आए थे
अरे मिनिमम ब्लड लॉस है होएगा ना? একটু পজ করো এগুলো করে দিই তারপরে
At this point, I want to see the central line once again on the USG machine. Yes, all the three lumens of the line are visible inside the internal jugular vein. This is an antiseptic dressing called tegaderm. The jelly-like thing which is on the inner surface of the dressing is coated with antibiotic, and it covers the insertion site directly so that there is decreased chances of any local infection. Dressing applied. I have written down a procedure note, and this is the X-ray clearly showing the central line going all the way down and entering the heart.